Hello, my name is Neil Greenberg and I'm here to present the REACT training, which is an active listening skills package. The background to this is that mental health problems are pretty common in the UK, and we know that around 1 in 6 people have mental health problems at any one time. There are some slight gender differences. Mental health problems appear to be slightly more common in females than males, and it's worth saying that there are various reasons that people develop mental health problems. So they may be exposed to traumatic stressors, either in their personal life or as part of their work. They also may be exposed to moral challenges which don't fit well with their view of how the world should run, and we'll talk a little bit more about that later on. Work issues are also important: how much work you've got, how much control over it, and how well supported you feel at work. And there's also one's home life, relationships, ill health, finances, and things like that. The difficulty with mental health problems is that most people don't go and seek help for them. They struggle on, they don't seek help, and they find it really difficult to be open about their difficulties. And some people even fail to recognise that they have a problem at all, when in fact it's quite obvious to many other people that they do. We're particularly talking today about traumatic stressors. A traumatic stressor is defined within a textbook called the Diagnostic and Statistical Manual Volume 5. That tells us that a traumatic stressor is one that involves death, serious injury or sexual violence, and it may be one that really happens or one that you perceive to be really likely to happen, so a near miss. And those sorts of incidents can also cause you to suffer with traumatic stress difficulties. You may experience traumatic stress either directly, or you might witness it, or it can happen to someone who's extremely close to you, and that understandably can affect you as well. But importantly, it can affect people in the course of their professional duties. So people who are routinely exposed to traumatic stress in their workplace as part of their day-to-day job. Once again, that may be groups such as certain healthcare professionals, social workers, particularly perhaps ones who work with children, emergency services, war correspondents, and so on. This slide comes from the National Institute for Health and Care Excellence. What this is showing is what's called a naturalistic study, which is how people respond to a single traumatic event: an assault, a fire, a terrorist incident, a death, and the like. What you can see here is that straight away after a traumatic incident, lots of people, in this case around 60%, appear to have lots of traumatic stress symptoms. And those difficulties might be just thinking about it all the time, being jumpy, not wanting to expose yourself to similar situations, or thinking that somehow the world is dangerous or different, or you can't connect with people. What you can see is that very quickly over the first few weeks, 4, 6, 8, 10, 12 weeks, most people recover, and that happens naturally without the need for any sort of mental health intervention or any sort of professional intervention at all. It happens because people speak to people they trust, they let some time pass, they engage some active coping mechanisms, and often they speak with others and try and make sense of what's happened. But you can also see in the longer term that actually around 10% of people in this case have a persistent difficulty. And those are the people who may have post-traumatic stress disorder. And the key point about this graph is to say that actually early on you get a lot of distressed people after a traumatic event, and that is completely normal. Most of those distressed people recover without the need for any professional intervention. Some support can be helpful, and you're left with an unfortunate group of people, a minority, but an important minority, who have this persistent problem. And what we want to be able to do is to identify people who might be falling into that persistently having problems category in order to make sure that they get the help and support they need. One last point to take away from this graph is to notice that even after a traumatic event like armed robbery, about 40% of people don't have symptoms. So not everybody responds in a way where they feel distressed and upset after a traumatic incident. This graph is now trying to show what happens with what we call type 2 trauma, which is the trauma that happens day to day within a workplace, such as intensive care units, such as in emergency service settings, or maybe in a war zone. And what we can see here is actually, for most people, we go along at about 70% efficiency. So we get along with people most of the time. We have a few ups and down days. There's a few who seem to go along at 90% and do an awful lot of activity all the time. And there's a few kind of people who seem to get away with not doing too much. Good jobs if you can get them. Now, if we use the example of Bob the builder, who works on a building site, regularly goes along and tends to be quite a happy sort of individual, but unfortunately a single incident happens. Maybe there's a construction failure and a building falls down, maybe someone's badly injured. Bob goes from being his normal happy-go-lucky self to actually not being so good in terms of his mental health. So he might come in there the next few days late, he might be irritable, he might even smell of alcohol. You'd hope that Bob's colleagues would spot that something's up because there's been a real change as the result of a single event that everyone knew about. However, the type 2 trauma is the ones that happen on a regular basis. So going back to Bob, let's say he's on a pretty poor building site where there's lots of accidents that happen over a period of time, and gradually Bob goes downhill. But no one really spots it because there's no one single big incident that has happened. And then what happens is Wendy says to Bob, right Bob, we're going to move your chair from there to there, we're going to move your desk. And Bob goes, do you know what, that's it, I've had enough. And he walks out. And Wendy thinks, that's so unlike Bob, because Bob's normally a very happy, easygoing chap. And actually Bob was a happy, easygoing chap some time ago, but he's been going gradually downhill. And no one's really spotted it because no one's had a chat with him to find out how he's really doing. And of course, every time they have talked to him, what he said is, I'm fine. And Wendy's gone, well, that's great. And really, what they've been missing out on is this gradual, stepwise deterioration in his health. Another topic that's really important in terms of the mental health of people working in challenging environments is this topic which is called moral injury. And moral injury is a topic that first got looked at with the military, but it has great relevance to lots of other organisations. It refers to a situation where something happens that strongly clashes with your moral or ethical code. It's something that you just know is not right, it shouldn't have happened. It's not a mental health problem by itself, but it's associated with mental health problems such as post-traumatic stress disorder or depression or other mental health difficulties. The particular problems with moral injury is that they tend to lead to intense shame, anger or guilt. And that can lead to people not wanting to talk about the situations that have caused the moral injury because they worry that other people will judge them. They might think they're a monster. They might get in trouble. I've done something wrong. If I tell people about it, what will they think of me? Will I lose my license? Will I lose my registration? They also might be worried that other people will think that they're somehow weak, that there's something wrong about them and they're not someone who should be respected. And also they may well not want to get their colleagues into trouble because they've seen things that they think are just not right. And so what happens is because they don't talk about it and because it sits there, it can be a vulnerability that persists over time. And the difficulty is that if they then do go and get help for a mental health difficulty, because this shame, anger and guilt is particularly difficult to deal with, they talk about the traumatic nature of an event, the actual moral injury aspects, because they really feel that their therapist or the clinician isn't in a good place to hear it and they wouldn't know what to do with it if they did. So the challenge here is, how do you spot someone who may have a mental health problem, find out how they're really doing, help them improve their situation, and if you can't do that with them, to get them to access professional help that may make an important difference to them. And that's where the REACT intervention, the REACT conversation comes in. These are the sorts of situations that you should consider having a REACT conversation with a colleague if you are worried about them at all. They may have been exposed to a particularly challenging role, something they're not used to, or a period of time where they've been exposed to lots and lots of really difficult situations which are out of the ordinary for them. If you see out of character performance or behaviours, something that you think, I wonder why that's going on. After a significant life event for them, perhaps a bereavement, perhaps a separation, something along that sort of line. When someone comes to you and says, have you got a moment for a chat? Or someone asks to speak to you about something that might be sensitive. And also when someone's experiencing a crisis, when you need to find out how they're doing in order to try and help them improve their situation. So this is the REACT approach, and what we're going to do is to run through all these 5 elements of the REACT approach in some detail so you feel confident in using them to help support your colleagues. And the REACT intervention is how to recognise someone's got a problem, how to engage with them so that they speak to you, how to actively listen to them, how to check risk, and then importantly at the end, once you've done that, come up with a specific plan that may improve their well-being and their mental health. It's important to remember, however, that these REACT conversations are confidential. You should not be breaking anybody's confidence about what they tell you unless you have a really serious concern about their safety or the safety of others. And if you get to that situation, you should always discuss that with the person in front of you first. But we will talk a little bit later on about where you might get some support with making those sorts of decisions. So the first bit of the REACT intervention is, how do you recognise that someone might have a problem in the first place? And there's 4 aspects to this that you should think about. The first is, has there been a change in their behaviour? Has their performance gone down when actually they're normally a really highly performing individual? Has their timekeeping changed? Are they turning up late for work? Are they missing meetings or always having to leave early? Are they more irritable and snappy than they used to be? Are they more withdrawn? So the key thing here is looking for indicators that their behaviour has somehow changed over a period of time or after a specific incident has occurred. The next thing is, has there been a change in their way that they express their emotions? There may be people out there, for instance, who regularly have a little cry, and that's what they do. And if that happens and that stays the case for them, that's not necessarily an indicator they have a difficulty. But for someone who doesn't normally have a cry and then starts to do so, that may indicate to you that something different and important is going on. And that also might say the same for someone who might be angry or despairing. Has there been a change in their emotions that you can see? What about their thoughts? Again, there are people around who regularly complain about things and seem to have a negative view on the world. And that's not a good thing, but it's not necessarily something which shows that there's been a change. But if a person who's normally quite neutral or positive starts to say, well, there's no point, or it's all going to go wrong, that again is an indication for you that you should have one of those chats. Or someone who's not just negative about other things, but might be negative about themselves. They might use phrases such as, oh, I'll never get this right, or this is never going to work, or I'm no good, when that's something you're not used to hearing. And then the last thing is thinking about physical symptoms. So again, there are plenty of reasons that people may have physical symptoms, but where they keep talking about them at work, or they seem to be affected by symptoms, they're not getting any help and they're just niggling at them and causing them difficulties, it's possible that there's a psychological reason behind them. So any of those 4 things could indicate to you that you may need to have a chat. And the way to start that chat is to say, how are things? How are you doing? Use an open question which doesn't have a specific answer, and see where you go with that. Hopefully, people will start talking to you about what's going on, but they might not. And if they don't, your first way of trying to get them to open up a bit is to use the information that you've seen that's caused you to worry, so changes in their behaviour, their emotions, their thoughts or their symptoms, as a lever to try and get them to speak to you. So you might say something along the lines of, I hope you don't mind me saying, but I've noticed that you're turning up late for work, or that you seem less sure about what you're doing at work, or you seem to be more irritable than you normally are. So to use what you've spotted in a sensitive way to try and encourage them to open up to you a bit. And if someone goes, well, actually now you mention it, and they start to talk, you should seize the moment and actively listen to them. And we'll come on to that a bit later. However, if despite that initial best effort by you, they still go, no, I'm okay, you then move on to engagement tools that might help them talk to you a bit more easily. And so the 2 simplest ways to do this are to use either your own experience or the experience of others that you're aware of to try and help open somebody up and to talk to you. So what you might say is, if someone's having a tough time, you might say, I remember back when I first started doing that sort of incident or that sort of intervention, I found it really difficult. Or if someone says, no, I'm doing okay, you might say, well, I'm glad you are, but I have to say, I've been finding things really difficult recently. And the purpose of this information isn't to try and talk about you, it's to try and encourage them to recognise that actually you and they might share some similarities, and that might encourage them to go, well, actually, now you mention it, blah, 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 and to start talking more honestly. Another thing you can do is to share other people's experiences in a really careful way, which doesn't reveal anything about other people. So saying, for instance, well, I'm glad you're okay, but I have to say other team members in your situation have been coming to me telling me that they're finding things difficult at the moment. And with both those two ways, what you're suggesting is it's completely understandable that that person in front of you may be having some difficulties and you really want to listen. The focus has to be clearly on them, not on you, and you've got to show that you actively want to listen to them. And what you need to do is to be encouraging, and we'll talk about that in a second, and not to have distractions around. So you don't want to be looking at your mobile phone all the time or just be waiting for someone to come in a door. That doesn't help with engagement. So hopefully you've now encouraged someone to speak to you in some way, and what you need to get on now is to give them a really good listening to. And one of the biggest barriers to effective active listening is trying to problem solve things too early. So when someone tells you something that causes you some concern, what you shouldn't be doing is going, yeah, well, what you want to do is A, B, and C. You need to just nod and listen, encourage them to tell you more, and you can save the problem solving until the latter part of the conversation, which we'll come on to in a bit. Use your eyes. Really good eye contact helps, not all the time. And if you feel slightly uneasy about looking in someone's eyes, looking at the end of their nose is a really good way. Make sure you use supportive gestures, so nodding, encouraging, perhaps using words such as or sounds such as in order to encourage people to speak to you. And it's also important that you acknowledge, if they're telling you something sensitive, that you recognise that it is difficult. And then another point that's useful, and we'll come on to some more tips in just a second, is to use paraphrasing or summaries to show that you're listening. So can I just check what you've told me is A, B, and C, is that right? And that shows that you have been listening and you understand what they're telling you. And just again, say it once more time, listening is an action. So make sure you do it actively, and that will really help someone tell you the important things that you really need to hear. So here are just 8 active listening skills which are helpfully, I think, summarised into more pies as a way of trying to remember what these skills are. So encouragers are things like nodding your head, saying or ways of showing that you really want to listen to the people. Use open-ended questions to start off with, and then once you've used those open-ended questions, it's absolutely fine to say, can I just check, did you mean A, B or C? That's fine, but don't start with the did you mean A, B or C, start openly. Use reflecting. What that means is a way of showing that you understand that someone's talking to you about difficult emotions, and the best way to do that is to say, that sounds as if that was difficult, that sounds as if that might have been quite frightening, words along that sort of line. Another thing you can do is what's called emotional labelling, and that's where you see an emotion in front of you, and therefore what you do is you say, I can see that has made you quite angry, or that looks like that's made you quite distressed. So to label what you're seeing in front of you. Think of your own posture and eye contact. If you crossed your arms, you're going to have a certain sort of impression on others, whereas if you have your arms open, then actually that suggests that you are more willing to hear information. Think about the way you sit in a chair as well. Do you lean slightly forward, which is slightly more encouraging, and then not to lean too far back and appear as if you're disinterested. And if you do happen to have, say, a bad back or a bad knee, by all means say that to the person you're speaking to so they don't misinterpret you sitting straight as a sign of disinterest. If you feel irritated by what someone's telling you, try your best not to show it. So when you show your eyes being wide or you look shocked at what someone tells you, it may make them hesitate from telling you exactly how they're doing. So try as best you can to keep yourself composed when they're telling you things that are irritated. But by all means speak to other people about it later on, because you don't want to take that home with you. Use pauses. And so when you ask a question that might be difficult, like, can I ask you what happened next? give it a few seconds before you jump in with yet another question. Sometimes people take a little time, maybe 4, 5, 6, 7 seconds to formulate what they're going to say when you've asked them something difficult, and therefore give them the time to do that. And as we said, summarize and paraphrase, because that's really useful to make sure that the person feels understood. One last active listening technique is to use what we call the Tom Jones question. So if you want to speak about, say, poor sleep, instead of saying, how's your sleep? You can say, it's not unusual that people who are having a tough time find their sleep's been disrupted. Can I ask, is that the case for you? So that Tom Jones approach of it's not unusual is a nice gentle way to suggest you know that something might be a problem and you just want to check it out with the person in front of you. And then you come on to checking risk. Now, having given someone a really good listening to, you may have heard things that cause you some concern. You may have heard someone talk about dark thoughts, or there being no point, or that they're going to leave, or they're going to do something which you think is probably not such a good idea. And what you need to do is to check out whether what you've heard is really something you should be concerned about, or whether it's someone just venting off about whatever it is they're talking about. So that you're checking here for, have they got dark thoughts? And I mean here, thoughts that might lead them to harm themselves or others. Or are they thinking about doing something drastic, telling their boss what they think of them, leaving, not turning up for the shift on the next day when they're meant to come in. And the way to check this out is to use forward-focused questions. So, because what you're looking for is risks that may happen in the future. Saying things like, what does tomorrow hold for you? Or what's top of your list for doing when you get home? And if someone goes, well, tomorrow I'm going to go out with the kids, or I'm going to go do some online shopping, or I'm going to watch a film, that's good and reassuring. They've got things in their plan. But if they say, I don't know, there is no point to tomorrow, I've got no idea, you then need to move on. And what you're looking here is to move on to a point where you are comfortable that you've identified, as best as you can, what level of risk that you're dealing with here. And we use what's called a stepped approach. So if you're worried about someone's future, you don't start off by saying, can I ask whether you are thinking about ending your life? That's a difficult thing to start there. But it's absolutely a good thing to start by asking questions such as, what's your thoughts about tomorrow? Or have you ever had a thought where you think there's no point in going on? And if they say they think there's no point in going on, have you ever thought what you might do about it? And if they tell you what they think they might do about it, you can say, have you ever made a plan to do it? You know, where do you think you're going to do it? Have you thought about a particular time? And of course, if you need to ask that frank question. Can I ask, are you thinking about ending your life? But clearly what you ask is dependent upon what you've heard during your active listening session. But this is a difficult topic at times, and people really worry that if they ask these sorts of questions, they're going to encourage someone to go and do something drastic. And all the evidence we have, and there's a lot of it, says that merely asking people about a bad outcome will not make it any more likely to happen. In fact, it's far more likely to make it not happen because you're going to do something about it. So just to remind you, the risks we're looking for here are risks to self or others, or some sort of occupational risk, such as not coming to work, not turning up, or doing something bad at work. So you need to ask enough questions, accepting that these are difficult questions, but you won't make things worse, in order to correctly identify this risk. And it's important for you to remember that at times bad things do happen. And if you've done your best to identify the risk here and the bad things happen, well, you know, these things just the way they are. Once you've given someone a good listening to, you've asked about that risk, you then need to think about, what am I going to do about it? So someone who's green, they've got a few niggles, but nothing that's caused you any worry. You should reassure them that things sound like this is completely understandable given their situation, and you're always available, but the good news is it sounds like there's nothing more that's needed at this time. If someone's red and you've identified that they're thinking about ending their life, or they're thinking about doing something drastic, then what you need to do is to make sure you get that person to professional help. That's beyond the active listening skills phase of trying to intervene. You need someone who can manage that risk actively, and you need to discuss that with a suitable professional, whoever that might be. However, if you're yellow or amber, that's when you come into the situation of thinking, how can I make this person's life better? So yellow is not sleeping ideally, poor concentration, a bit more niggled than normal, not entirely sure I'm enjoying things as much as I used to. Well, how do I get that person back to green? And amber is a situation that's slightly more severe than that, shouting at the kids, drinking too much wine, haven't really slept in days, not really doing anything other than thinking about work. So yellow and amber are grades of that same situation, which is you've got someone in front of you who's got some difficulties, and between you, you're going to work out a plan to try and make that better. And the aim here is, when you're in the last phase, which is talk about specific actions, is what can you do to improve someone's difficulties? And what you're trying to do here is to come up with a plan to do problem solving, to make sure that plan is one that they're happy with, not just the one that you tell them to do. And if you're not sure what to do, check in with them again, or ask somebody else about how you might support them better, again respecting confidentiality. Just worth saying here that if you're really busy, so you're having what you think is a 5-10 minute chat, but at the end of it, it turns out there's a lot more going on, it's absolutely fine to say, look, it seems like there's a lot here. Can we come back and perhaps chat about it tomorrow? Can I give you a buzz later? Can we revisit this? But if you make a plan to do that, you must stick to it and not just let these things drift. These are the 5 phases of problem solving. Identify the problem, and people quite often might say things such as, it's all rubbish, or I never do anything right. Well, that's not overly helpful. What you need to do is to define that. What do they actually mean? Well, what I really mean is there's a piece of equipment, I've got no idea what it means. Each time I use it, it's got lots of buzzers on it and different settings. All I know how to do is 2 things, and I'm really, really worried that I'm going to make a mistake. Okay, so now we've defined what this particular problem is. This is causing a lot of anxiety. Then we need to explore what can we do about that particular problem. So in the case of this piece of equipment you don't know how to use, we can say, well, what do you think will help? And that might well be, I need some support. It might well be, I need some extra tuition, I need some mentoring, or I need to read the manual. But identify what are the potential solutions to make that situation better. Then you need to decide with them together about what's the best action. Well, in this case, maybe what I'll do is I'll read the manual properly tonight, and then I'll know whether I need more support. Okay, that's the plan we're going to go for. Let's check in tomorrow once you've read the manual, see how it's going, and let's work out whether that's the right sort of solution for you. And then we look back, and if that hasn't helped, then what we do is choose something else. Maybe in that case, I'll speak to my supervisor, because actually they may be able to show me, give me a 15-minute teaching session on it, and actually that's what I might need. So use the problem-solving approach to try and solve any problems that are appropriate that actually might make people's mental health a bit better. Now, there's a lot of information that I've just given you in that presentation, and what you will be getting on this course is a sheet, an aid memoir to help you as you're doing these active listening REACT conversations. This sheet is going to show you different areas to remind you of all the things I've just talked about. And what you can see here is, first of all, how to, when you should conduct a REACT chat in the first place, what sort of situations should tell you that a REACT chat is needed. It's got an overview of the REACT acronym there with the 5 different stages. It's got a little bit of information there about the green, yellow, amber and red, and then something about how you follow people up, about when you should speak to people again if you're worried, remembering that if they're green, you probably don't need to follow them up, they're okay. And if they're red, you're not following them up directly, you're making sure they get forward to get some professional support. And there's some information here about confidentiality, about what you should do if you feel the need to break confidentiality, which you should only do in pretty exceptional circumstances if the risk you identify is really substantial. And then if you do break confidentiality, you only need to do so in a way that affects the risk. You're trying to reduce the risk. And the way that you can do that to start off with is to speak to another REACT trained person or a supervisor or a mental health professional, and you can first of all start off by saying, can I just talk to you about a situation that's happened lately? So you don't need to mention the person's name who you've seen, and therefore you can talk about the difficulties that you see from the active listening skills conversation you've had, and if those difficulties are really hard and ones you can't deal with easily, then the supervisor can give you some advice Or they might even say to you, do you know what, actually, I think you need to tell me who that is because we need to do something about this. The other bit of this sheet is some tips about how to have those active listening skills conversations. And you can see here, we mentioned the Tom Jones phrase. It's not unusual that. And then there's a whole range of different things that you might want to ask about in order for you to identify what sort of plan you want to put in place with the person you're speaking to, and also what level of risk you're thinking might exist in terms of negative futures, be that dark thoughts or be that worries about someone's function at work. And I won't go through them all, but on that sheet, that if you seem to stumble when you're having a conversation, a quick look down at that sheet will help you, for instance, to ask about people's future or appetite or sleep, or enough information so that you can have a decent conversation. And then really importantly here is when you come to that problem solving stage is to make sure that you ask them, what do you think would help? Because often people will have their own solutions and you may be able to help them through a problem solving process, actually put in place one of those solutions, and that works for them and of course will make their situation better. I mentioned here also about documentation. If you're having one of these conversations, you really should document it and keep that information securely. If you do document things, clearly you need to think properly about GDPR and confidentiality, and that will vary how you do that depending on the organisation that you're in. And then what's also really useful is to have a list of supportive interventions that might be in place, and that might be things such as where the welfare provision is, do you have an employee assistance program, is there any sort of professional support within the organisation? Because if you're going to suggest support, then you need to know where to indicate to people that they should go. Just worth mentioning here that the term signposting is often used. It's not a great term because signposting kind of suggests, I'm telling you where to go, you go and do it. If you can, what you want to do is to assist someone, is to say, let me help you, or can we check in that this has actually happened, to make sure that if you put a plan in place, that actually that's going to make a positive difference. So the conclusion of the REACT active listening skills intervention is to use a gentle but persistent approach. Try and stay sensitive. These topics can be difficult at times. If you're in doubt at all when you've had this conversation about what you should do, you should really speak to someone else about it. You should not be left holding this worry baby by yourself. And as I said, you can speak initially in a completely confidential way without giving someone's name or details, and then ask for the advice about what you should do. And if, despite your best efforts having a conversation, someone doesn't want to open up to you, that's okay, that's their choice. But try and be persistent, leave the door open or the drawbridge down, and perhaps when you see them next time, try again and show that you're focused on them. You're not trying to be someone who's being overly nosy. You actually are interested in their welfare and you're willing to have that conversation. And hopefully at some point they will begin to realise that and tell you the things that you need to hear to try and help them improve their lives. What we can do now is take some questions. And this is the demonstration. And so now there's an opportunity for any final questions you might have about either the demonstration or the presentation before you get on and do your REACT training practice yourselves.